Am I audible?
Yes, sir. Yeah, you're audible, sir. You can start.
Okay. So I have the privilege of introducing Dr. Nanda Kumar. I suppose it's because I've been a patient since July last year. Dr. Nanda Kumar is a consultant and an interventional cardiologist trained in Birmingham, UK. He's on the board of he's on the board of European Cardiovascular. He's a member, sorry, he's a fellow of the European Cardiovascular group. Yeah, that's fine saying. Yeah. He's also a member of the European Association for Cardiovascular Prevention and Rehabilitation. He's on the advisory board of Ministry of Health and Family Welfare, Government of India for non-communicable diseases. He's also a senior consultant at Sri Ramakrishna Hospital and has his own private practice at Heartlands Clinic in Coimbatore. That's near Saudi Palam. So, Doctor, welcome to our session. Request you to please address our alumni.
Thank you, Pratap, for your kind words and introduction. Firstly, thank you all at BS Med. Thank you, Gilbert, for initiating this, and Mr. Manikandan and Mr. Kanagaraj for coordinating this session today. It's been a pleasure being around all of you because I haven't met most of you people at BS Med. Probably the circumstances are not at its best, but still, I think it's a pleasure to catch up with you all this evening. When I was just thinking what should be the topic for today, I think it's COVID season, it's Corona season, isn't it? So everything and anything you talk will have Corona in it or some part of COVID in it. So we thought health beyond COVID or health surrounding COVID is what I thought I'll touch upon this evening. I'll try and speak for whatever length of time, probably 15-20 minutes, and then we can have an informal chat following that. So India, I think we as a country are quite heavily populated, and for most part of the 20th century, we struggled with infectious diseases or diseases that communicate between humans. 20th century, we started seeing a lot of problems with vascular disease or disease which are non-communicable, things like high blood pressure, diabetes, heart disease, etc. Of course, cancer, stroke, and things like that. So now I think this pandemic has taken us back again to our focus on infectious disease and how well we tackle them and how best we can come out of the current situation. As you know that I'm on the advisory board of the Department of Health for non-communicable diseases. The last meeting we had was on February 17th. Least any of us expected on the board that we are going to be talking on communicable disease or infectious diseases and take our concentration off the non-communicable diseases. That was a very vibrant meeting, which wherein we even talked a lot about how we prevent accidents, and we got NHA people on board, chaired by the health minister himself. So, but least we expected that the focus will switch in 4 to 6 weeks' time. So, if you look at health per se, I want to discuss this on two different headings. One, the corona part itself, and the other one surrounding the COVID issue. So I'll discuss a few things about the COVID itself to start with. So one thing about this is we all know it's a viral infection that surfaced and playing on all of us. I'm really sorry. Am I visible at all? I cannot see anyone at all. I'm off.
No, I can't see you either.
No, sir. We normally stay on mute.
Stay on. Okay, that's fine.
Yeah, we have a video cut for the bandwidth.
Sure. Yeah, that's great. That's great. So we all know it's a viral infection that's very contagious and spreads very fast. There have been several viral infections in the past, which presents as common flu, and then this one, the specialty or what we have understood so far about the current one is it's very contagious and spreads very fast. In terms of the recovery, most people recover without absolutely no symptoms at all. That's about close to 85%. About 10% of them can have very minimal symptoms and recover spontaneously without any treatment. The rest 5% can get into trouble, of which about 2% can have life-threatening issues. This in the broader sense. So how this is going to change our lives and how this has changed apart from the lockdown. So in terms of what you need to do during this period is try and capitalize the break you have had from your routine work. For example, if somebody is already a patient and on medications, one just have to continue medications. A large part of what I'm going to say is related to the general as well. Most patients who have been on tablets for high blood pressure, diabetes, heart disease, either with stents or with bypass surgery grafts, you need to be on medications without any interruptions at this point in time. In terms of diet and exercise, we all stay indoors these days, so there's very little outdoor exercise that's possible. But still within the place where you live, you can create opportunities to increase your physical activity. I'm sure you're all in various businesses and you look at smart ways of handling things. Things like, doing 3 or 4 different jobs at any given point in time. You should exactly do the opposite. You create more and more work within the house and then increase the physical activity possible. You go upstairs, keep coming down, go up and come down, go around the house, do some gardening, wash your vehicles, things like that. So, and in terms of the diet, you will not only have to reduce the quantity in what you take, but also be smart enough to get the kind of nutrition you need. So increase the intake of vegetables and fruits, come down on carbohydrates like rice. I don't know if meat's going to be available, but it will soon be. If that's the case, you can take boiled fish and things like that. So vitamin C is important. That's been documented. So you can take in fruits like oranges, lime, and other vitamin C rich foods. So this in broad about what you can do with diet, exercise, and your medications. But in general, if you look at what WHO says about health, it says about your physical, mental, and social well-being. But these are extremely challenging times. COVID is playing, so emotional is also extremely crucial at this point in time. A lot of patients call me for help. They're actually quite well. They're not unwell at all. But the kind how best we can turn this and make it positive is very important. So in terms of staying indoors, I think for vast many of us, staying at home for this long time period is extremely rare. In fact, it's probably never happened in our lives. So I think we should try and do things that we haven't or have not been able to do despite wanting to. Things like spending time with family, with calling up a few friends we haven't been able to for a very long time, listening to music, reading up some books, catching up with parents, friends. So although they say it's, social distancing is important, I would want to call it physical distancing is what you need and not social. I think you should enhance your social network. You should try and catch up with more people, learn something new, listen to some music, and do various things that will translate into a lot of benefits with mental and emotional health. Why am I stressing so much on mental and emotional health is it's directly related to heart and heart-related problems. For ages, stress and emotional health have had a direct relation to heart disease, especially with things like heart attack. I would like to share something very important with you. World over, what we cardiologists have noticed is there has been a drastic drop in the amount of heart attack patients. Just been a drastic drop. And there's not been a day where there is no session or where there's not been a discussion on why this has happened, and nobody is very clear as to why this has happened. But this is a fact. The number of heart disease patients have just dropped down drastically. Contrary to what has actually happened, we were thinking emergencies will be there, and so we'll all be extremely busy in our theaters, but that's not been the case. A few things have been said why this has actually happened. One thing is we probably are resting quite a bit more, quite as what we should. Earlier, probably we were not sleeping enough, we were not resting enough. Earlier, there was a lot of stress going even to work, the traffic, the signals, the workload, the targets and things like that. Mind you, all this will come once the post-COVID goes, but then the reasons why things have gone quiet, and that's for good in many ways, is because probably we are not exposed to the routine stresses that we have. I'm not taking away the fact that a lot of us will keep thinking what will happen to the finances, the economy, the businesses, and how are we going to turn this around. But at this short point, in about 3 or 4 weeks' time, this is a big change that we have seen as cardiologists. The road traffic accidents are not hardly there, but that's got a clear explanation as to why that's happened. But the vascular disease, even I'm told there's not been many stroke patients who have been coming to the hospitals. So that's a good thing. There are a few other explanations, things like smoking. A lot of men folk cannot smoke at home, and it's not easily available these days as well. And also when we talk about stress, there's a lot that's subconsciously or subclinically happened. Spending a lot of time with family would have taken away this stress. Because I cannot stop quoting a 19th century surgeon from England, John Hunter. I've used this quote a few times in the past when I've spoken elsewhere. He was a type A personality and was always worked up, and he knew that type A personalities or extremely aggressive personalities tend to have vascular problems like heart attack and stroke. So this was described ages ago. So he actually died post a major argument with one of his colleagues. But prior to all this, he had actually once said, my life is in the hands of a rogue who chooses to tease me or annoy me. So all that is not there today. We are at home most times than before. There's less turbulence in offices and traffic on the roads and whatnot. So some way or the other, things have been good in many ways. But of course, how are we going to tackle this post-COVID or the post-corona time? I'll be extremely candid. This is my understanding of this particular disease. This is not ending anytime soon. The vigorosity of it might, but this is going to stay like any other flu, like what we had with swine flu. The swine flu was not this rampant. It was not this aggressive in terms of its contagiousity, but then this one will stay for some time. in the society and across the globe. So that lays a lot of importance as to how best we protect from being affected. Having said that, the ultimate remedy of getting off this disease or the numbers starting to come down is when we develop herd immunity. That's how most viruses have been kept quiet, because we all have developed immunity for most strains of flu viruses, and eventually we all have to develop that kind of an immunity to not to be infected from this virus. So that will only happen over a period of time, and this particular lockdown period obviously is extremely advantageous because it's probably at getting to its peak, and then this is the time where physical distancing will prevent a large number of people from getting exposed. One. Two, it will also give the healthcare system to have some understanding as to how one can tackle, because a large surge of patients into any healthcare facility across the globe is going to be a huge trouble for anybody to tackle. And when this happens in a very gradual manner, as it has been done in a couple of states in our country, herd immunity will develop. That's when we'll all be sort of asymptomatic or very mildly symptomatic, and things will keep moving on. There will be casualties, that's the hard fact, that's the truth, but then we'll have to try and keep ourselves as safe as possible. All we need to please remember, quite a few things have been known about this particular problem. There's quite a bit that's being understood. We're trying to understand what this is all about. People are working, researchers are working, trying to find out what else this could be any different from the previous viruses, what treatment options are available, when can the vaccines come up, and things like that. But we as common citizens, what we need to do is extremely crucial in slowing the spread or making it less rampant. One is physical distancing. Second, you all would have heard and read a million times in the last 4 or 5 weeks about hand washing and masks. Extremely important. When you all open up your offices, we are functioning, the hospitals are functioning. When you open up your offices and your business establishments, please ensure that frequent hand washing will help quite a lot. Because hands are something that's moving, and you take it onto the tables, onto the cars, on everything that we touch. And that's how it can get transmitted. Masks are very important. Coming back to hand washing, I think once again, I'm sure you've seen videos and leaflets and describing how you should wash your hands so that all parts of your hands are equally well cleared of the virus that may have come up. So coming to the mask, it again, wear a mask, wear a mask, wear a mask, Mask India campaign, things that have been well propagated, and rightly so. But then very simple things about the mask is what you have to know. Generally, the so-called the N95s or the other masks are mostly for people who are exposed to potential patients or potential COVID positive patients in a healthcare facility. Otherwise, all you need to generally do is to wear a simple surgical mask. And when this gets very, very rampant, or if it were to happen, if it were to increase, the numbers were to increase, and even if it were not to happen, I think we'll all end up wearing masks on a routine basis for a few months till we all develop herd immunity. So cloth masks are something that's not bad at all. It may not match up to surgical masks. Surgical masks might not match up to N95s, but you need protection. Please remember, it's every individual's responsibility, and it's not something that when we wear, we are protected. It's not like that, because that has to be mutual. The person in front of you should also be wearing it. And I would just like, Mr. Manikandan, is it possible to get the video on? I just want to have a quick demonstration of how to wear a simple mask.
Yes, sir. Yes, sir. It will be done. Just a minute, sir. You can yourself, you can also add. So I also given a request from my side.
Am I visible now, please?
Yes, sir. Yes.
Just before putting on the mask, please ensure you use a bit of sanitizer or wash your hands with soap and water. Make sure your hands clean before you put the mask on. And this is a very simple surgical mask. Very simple surgical mask. All you need to do is have this on your palm, and then just wrap it around your face and your nose, and take this tag behind your ears and this one behind the other ear, and then tie them behind. And the same you do for the lower portion, and then just tie it up like this. So the mask, and just you could just give it a gentle press here. You should fit and cover your nose and mouth adequately. That's the. This offers enough protection. So you don't have to what it is. So unless you're exposed to healthcare personnel or to patients or in an ICU setup. So this is for general use. And when you try and take it off, try avoid taking off the top bit first. Take off the lower one first. Just untie the lower one first, and then the upper one, and just remove it. The reason being is if you take the top one first, it is likely to fall back onto your neck, onto your shirt sleeve. So when you do the other way around, the grip is on and you just have to take it off. And extremely important to dispose it off in the right way. You could just put it in a bag or a cover that's not accessible, or shouldn't be touching it once that's done. If it's for a couple of hours, and you could wash it. You could have multiple such masks, not the surgical one, the cloth masks, where you could reuse it. You could label them as good enough, and then for a period of 3 or 4 weeks, you could replace them with the newer masks. So that's a way to do it. And also, please do not rush to buy sanitizers if you're staying home. If you're at a workplace, for sure sanitizers will help, because as doctors, for us, sanitizers are very important, because we cannot keep going to the hand wash area with every patient we see. So sanitizers are good where you're moving from one place to another in very quick succession. Hello.
I requested all the participants to stay mute. Now it's clear that I have muted them.
Thank you. So these are very, very simple measures, but they go a long way in spreading out or getting these infections from another person. So kindly try and follow these basic measures once you get back to your work. And whilst at home, if there are elderly people, it's probably advisable for the youngsters to wear a mask if they keep going out and coming back in for shopping essential goods. Otherwise, generally, these are the measures one can do. That you take for any infection. So hydrate. These are very little things, but they are extremely important. So please hydrate yourself well. And I don't know how many of you have seen this, the 10th apple effect. There's been a video on social media, the 10th apple effect. I won't go into the details of it, but at the end of that video, it implies that what we haven't noticed for many, many years, COVID has made us notice. things, very simple things like, for example, we used to drive past to work and come back. Probably the huge supermarkets are visible today. A roadside vendor, somebody's selling a basket of fruit. All this has gained so much of importance. And I think in many ways, we are sort of humbled and equally, even in a healthcare setup for people like us, we have a lot of respect for people, not that we had not earlier, but we started to have a lot of respect for people who do the cleaning and who have been for the security and the various other people. So all this will translate into good health. That's always been my understanding. The way you live, the way you carry yourself, the way you've been to most other humans will always replicate into good health. That's what generally happens. And I think COVID in many ways will change a lot of things in our lives. And that's how I think this is probably nature's way of bringing about many changes in day-to-day life. That's one thing. I want to say a couple of things more before I end. Representing hundreds and thousands of healthcare professionals in our country, my appeal to you is, please remember this innings is going to be a longer one than what we actually presume it to be. So it's going to be there for some time. So you have to learn to fight it out in very simple ways, and do not panic. There's nothing to panic at all. This will go away like any other virus. But it's all about keeping ourselves a bit more safe and make sure that we are doing the right things as we go along. So that's my appeal to you. As a doctor, I assure you that things will change. I know there's a lot of science happening. There's a lot of research happening. So that's the assurance, because we have seen it all. Healthcare, we have seen H1N1, we have seen the swine flu happen. So this will go away in times to come, probably in the next few months.
Profile that you represent, Government of India in the NCD side. And it was quite shocking to know that 70% of the world's death is due to the NCDs, right? Including the majorly the heart diseases. And so, like there is a health insurance, at least within the organized sector, is there anything can be done, to help people invest on the preventive health, so that the number of deaths can be reduced, and also the proportionate expenditure as well. I remember, when I used to live in US, some of the healthcare companies, they used to give discounts on health insurance premium to those who have certain good health parameters, like BMI less than 25, subscription to gym, etc. So I'm just looking for some kind of a answer where people can do something in the preventive health side, and also get some incentive or encouragement from the government. Yeah.
This is absolutely a fantastic question, sir. I'm grateful that you brought this up. This is something that we need to work and get this in, because a lot was spoken even on that particular day on preventive aspects of heart disease or stroke and things like that. It's really up on the rise, although it's been quiet the last few weeks. There's a lot we need to do at the level of the government, and also at the level of the private organizations. On the same day evening, I was in another meeting. I'm part of what when I was in England, but we didn't take that forward. But we wanted to take this forward as Your Health Matters. The prime reason behind that was to rope in most major organized sectors first to start with, and ensure that their employees and at all levels or screen for basic risk factors like hypertension, diabetes, as you said, high BMIs, and address them aggressively at that stage and prevent them from getting into major end organ damage of the heart or the kidneys or the brain. So that will kickstart in the next few months for sure. From the government point of view as well, we'll try and push this forward to lay emphasis on that, because we all, I don't know how many of you are in business in this group, but I think every single entrepreneur or a business head should start to think the strength of that particular organization is directly proportional to the health of every single employee. That's the most crucial part, because what will translate into the end of the year boardroom statistic will be defined by the health status of the employee. So quite alarmed, and absolutely agree with you. The 70% is probably the world figure, but the number of young people having heart attacks and stroke is very, very high. And we as doctors and even at the level of the government, we are looking to aggressively address that. So there were quite a few things that was discussed on that particular day, and there's no point discussing that. But in a broader sense, I think we'll all have to pitch in. We'll all have to pitch in and develop a database. That's exactly what I told on the day. We have to develop a database where it's being followed up. Because one thing is creating awareness. For example, a particular individual, if has been told that has high blood pressure, it is his or her responsibility to follow it up. And most of these risk factors do not have symptoms. That's the worst part. A lot of times what has happened is I'm talking about the heart attack and the patient is actually showing the diabetic wound and saying this is not healing for the last 6 weeks. And I'm actually talking about the ones that's going to likely kill him in the next few hours. So what's visible is what's respected. And that's rightly so from any individual's point of view. So I think largely we'll have to create a database, and that needs to be followed up by a particular organization or a healthcare department, wherein timely reminders and we'll have to bring it down as something short of a law. We can't do this as short of a law, and people over a period of time in the next 4 or 5 years feel responsible, and it should be on the public domain. Health should be the most important thing to address.
In fact, I thought of opening a change.org campaign and collect some, work closely with professionals like you, get some kind of basic data points, and pass it to get enough public signatures, e-signatures, and pass it to the lawmakers. So like you said, like what has become to auto insurance or property insurance, or health insurance, some kind of some government enforcement towards preventive healthcare.
Yeah, definitely. And I think the insurance companies will be very forthcoming, because they would want to have a lot of healthy people on enrolling into their system, rather than enrolling somebody who they'll have to pay back again in the near future. And it's not difficult to have a set questionnaire or a set data on somebody who is 25-year-old or a 20-year-old, and take it from there. It's a very simple one-page, 3-minute or a 2-minute thing that we can do. And I'm grateful that you brought this.
Thank you. Thanks for your response. Yeah, thank you.
Next we can have Shankaran sir, and followed by Venkatapati sir, Rupa madam. Shankaran sir.
Yes, congrats.
Yes.
Dr. Nanda Kumar sir, it was a wonderful presentation. We enjoyed the explanations which you gave. I just have one small doubt, sir. Most of us have this annual health checkup, maintenance health checkup, and the hospitals have now advised, they've asked us not to do that at this point of time, just to ensure that we are prevented or we stay away from certain things. I just wanted to understand how long is this going to be? When can we do this? Or is it fine if we continue to take the medication which has been prescribed with the past annual checkup and continue with that till the situation gets over? Just wanted to understand.
Again, a very valid question, sir. Most people don't have to come for routine follow-ups, because it's about weighing benefit versus risk. So I think getting into a hospital just for a routine check, the risks are gently more than the benefit at this point in time. Whether to continue with the same medications, whether it is mandatory to take that small chance and still come and have a check, really depends on how one's previous records were. If there was something that mandates a check from the previous, if it's a routine master checkup and there's something to do with a little bit of high cholesterol and things like that, that should absolutely be fine. You just have to carry on with your lifestyle measures of diet, exercise, and you could continue medications without walking into the hospital. That's fair enough. If there is something like a scheduled scan, this I'm talking in broad and not to the members alone. If there is something that warrants a scan to follow, is a type of a growth that would largely change the treatment modality for a given patient, then they should at least get in touch with their doctors. It's as I said, it's not just the promise that I've made. It's extremely important, and it's the responsibility of a particular doctor to be accessible to their patients at this time more than ever before. I know it's not face to face, but at least they should be accessible on the phone or another method like an email or WhatsApp. I think one should be able to freely get in touch with the doctor and ensure that they're on the right track, and follow-ups can accordingly be arranged based on the situation.
Sure. Thank you, doctor.
Thank you, sir.
Sir, next, can we have Venkatapati, sir?
Yeah, good evening. Doctor,
Good evening,
it's
sir.
nice to listen to you. In fact, it gave some new insights to me, but I'm not going to have any doubt or questions. To corroborate with what you have been talking about, I feel there are three things that I can share with you in 1.5 minutes to 2 minutes.
Sure, sir.
Number one, everybody talks about this mask. You have very clearly said the surgical mask is fine, everything is accepted. At 3 rupees, masks are being sold in the road. And should we really make some kind of the change process being understood by people? Number one. Number two, we always talk about this preventive, this one, and your immunity system should be developed. And what should we really step up? How to improve the immunity system? Because people say, unless you have protein, unless you have this, and because of protein, everybody goes to this, the sweat shops that were working on Sundays, and that is actually transmitting the disease. Any alternative that people could really understand and use that? And the third one, the system has just started saying something and follow this. But the people like me, the ordinary citizen, have not understood what it is and why it should be. All along, I am in a different wavelength and different type of lifestyle. Now, to make them understand, should we really make some kind of social psychological aspects, or this preventive medicine, or maybe in health psychology, something people talk about, to substantiate the effort that they are already taking? Because I'm just wondering, because when we say don't go out and it is, people should also understand, because we are dealing with people who are in terms of literacy, in terms of economy, in terms of understanding, marginal. And this is some concern that I want to share with you. I'm not raising any question on this. And if you could be able to throw some light, and if people like me can understand that, I think that will be better. Am I? Thank you, doctor.
Well, sir, you have nailed it to perfection. Again, as you said, several masks available, people making various kinds of things. Well, I'll leave it to the understanding of most general public, because it's all available on the public domain. One can know where to buy from, and if it's a 3 rupee mask, we know what sort of quality it could be. Sometimes, if it's just sold on the road in unhygienic conditions, there's no point doing something just for the sake of doing it. And boosting up the immune system cannot happen overnight. It's not like a medicine. It's not like a fever medicine. You take a paracetamol and the temperature drops. It's a long-term thing. It's a long-term thing. It's like developing. It's your long-term. It's like managing your finance. So it's something that you will have to develop over a period of time with good lifestyle, good thoughts, good amount of sleep. Because this every small little thing that you do has a long way to go when it comes to boosting immunity. And the third most important thing is, in a country as huge as ours, it is very, very difficult. It's not a very small country. It's very diverse. The level of education, the level of understanding, there's so many things. And this is one thing on prevention is something that everybody should speak in one voice. If we are looking at a healthy society, say a decade or 2 decades from now, and if somebody has to say India has probably got the best of health across the world, then we'll have to do a bit of feedback. It should be like a Nirma soap advertisement. It has to be bombarded in regular frequency across media, across public platforms, and it's a long-term process again. And people like all of you should come in with various ideas and do that on a routine basis, in a day-to-day basis, wherever we work. It could be very little things that we could do on a day-to-day basis, but will have a large impact on long term. Thank you for your valid points, sir. Very, very valid points. Thank you.
Next, can we have Dr. Rupa Gunaselan?
Hello.
Yes, ma'am, you are audible.
Hello.
Yeah, am I audible? Hello.
Yes, ma'am. Yes,
Yes, ma'am. Good evening.
Yeah,
You are audible.
So it's a very minute aspects you explained to us. We know certain things superficially, but today we got a lot of insight about various preventive measures we casually do. So thank you so much for explaining all this, sir.
Thank you, ma'am.
And the big question here is, sir, to our population, see, today also for unavoidable reasons, I need to go to a grocery shop, wherein I could see people are not having awareness to have the distance and social distancing and spacing. So they were clinging very closely, and that gives a lot of worry to any person who knows the fact. So how
Very true.
government is going to handle this particular issue, and what kind of preventive measures people like us, when we go to place where people come and stand closely in spite of we telling, please give some distance and stand. So, and I come to know that the mask is not sufficient. Whatever mask you wear, that is not much sufficient for preventing completely.
Very true, ma'am. This has to be dealt with in a couple of ways. I think government will keep doing their part by saying it on television, bringing out in newspapers, the importance of social distancing or physical distancing is what I emphasized earlier. So the government will keep saying that in many different ways. I think it has to come in within every individual that this is extremely important, and it's not just in terms of there is an amount of selfishness in every human, isn't it? We all have a certain amount of selfishness in ourselves, and everybody should start to know that it's not just unsafe for the others, and it's actually unsafe for themselves.
Yeah, they are creating unsafe circumstances for
exactly.
Everyone.
Correct.
In spite of repeated campaign or repeated awareness programs and all those, and even in television or in a mobile phone, everywhere it is reflecting, but still people are not catching it up. That's what I really observed. And whatever preventive measures doctors are telling, like mask, I don't think that will really work in such circumstances.
No, exactly, ma'am, exactly. Because the distancing is very, very crucial. This maintaining a distance is very crucial. And if it's a shopkeeper, the shopkeeper has to insist. If there are 8 people standing and 1 person not doing, the rest 7 have to sort of gently
Yes,
request him or her to do it. And
yes,
this has to happen, and every individual has to pitch in. And over a period of time,
yes, sir.
we'll probably understand. At least we thought 4 or 5 weeks ago that somebody would stand in a queue in our country. I didn't hope that somebody will stand in a queue to buy things. Some changes have started to happen, and we should all
Yes,
be
sir.
very
Yes, sir.
optimistic and work towards it. And
Yes, sir.
in general, forgetting Corona or COVID, in general, we should be a society where we maintain hygiene, maintain that good distance, so that we're not transmitting. It's not about just Corona, isn't it? So it's all about good
Sir,
amount
one
of.
more question is,
Yes, ma'am.
this is really a a question which I want an answer from a doctor. There is there are cases where asymptomatic, like symptoms are not at all known, but still last moment they get that breathing trouble, and then they get admitted. Next day it becomes a different story. So
Correct.
why people are asymptomatic? Why do they medically? Why that is happening medically? Can you give some explanations, sir? If
That's common to all the viruses, because a lot of patients are asymptomatic. I wouldn't call them patients. A lot of them who have been exposed to this virus, vast majority of them asymptomatic, because the viral
okay,
load itself is not sufficient enough to make. It's multifactorial. It's just not the viral load alone. It's about
okay, sir.
how strong that individual's immune system is, whether the patient's actually got diabetes, hypertension, and other risk factors
Okay, sir.
to increase the sensitivity for the virus, or increase the chances of that translating into a symptomatic disease and further.
Okay, sir.
Being asymptomatic is in a way a strength and a weakness. That's the problem, because this does not
Okay,
cause symptoms. One could end up being very careless, and
okay,
if this were to cause symptoms to all the positive, the healthcare facility would buckle. So we should let this go past. The herd immunity should come up. We all should try and do things right to a greater extent, and this will
so
pass off.
it means that the patient is having a high immunity, fighting against that virus, and keeping himself or herself asymptomatic. Is that the case, sir?
Not really, ma'am. People who have a good immune system and
Mm-hmm.
not much of an exposure, they are likely to become symptomatic and get into that small percentage of
Okay,
people
it's other
where
way around. Fine,
they get
fine,
into the
fine, fine.
ICU.
Okay,
Exactly. Uh, you may ask why doctors were getting positive. You look at the death rates when doctors become positive, it's much higher compared to somebody who is
okay,
a non-doctor. The reason being the exposure to the amounts of the virus load, because if they're in a
okay,
COVID positive ward,
okay,
being exposed to that kind of constant situation,
okay,
then they're
okay,
likely to get bad.
okay, okay. Understood, understood. That's fine. Okay.
Thank you, ma'am. And next, we can have Mr. Manigandan, sir, and followed by him, there will be Manoj Kumar and Mr. Siri.
Good evening, doctor. I'm back again.
Good evening, Mr.
Uh,
Manigandan. Yes.
I have two questions. One, WHO is talking about test. With an official population of 1.3 billion, I don't know from where we will get the kits to actually do more tests than this. I do work a little bit in Kerala, so they do quite a lot of testing compared to a state like Tamil Nadu. Because in the interaction that we've been having, so a little bit of clarity on does increased testing help us, rein in this problem that we have, is my first question. Second question is again related to what exactly I've been hearing. I had a set of my doctor friends talking about something called as the immunoglobulin, and they say that's exactly the way to go forward if we have to find a kind of a remedy or a reprieve in the current circumstances. So testing for immunoglobulin or trying to adapt that, is that what they talk about from a plasma therapy concept right now?
Sure. Answering your first question, Mr. Manigandan, testing is like a double-edged sword. Say, for example, as you said, in a country as populous as ours, if you say you get that many kits that you want and you test everyone, so what are you going to do with all the positives that you're going to get? You're going to get innumerable number of positive people. So what are you going to do with them? They might be absolutely asymptomatic. So you're going to quarantine, you're going to offer quarantine to them and presume that things will settle down. It might, but it might not. The reason being the incubation period, because if you look at somebody negative doesn't exactly mean they are negative. Say, for example, you test an individual and label them as negative. They could actually turn positive in a couple of days. So how frequently are you going to keep testing them? So that's not practically possible. But the positive side of it, if you start testing more and more people, you should have that kind of a healthcare infrastructure, say, to accommodate that kind of people for quarantine. So it's like it's a double-edged sword. It's not easy to. If you look at any of the developed countries, they're not testing everyone in the society. So there should be some sort of a symptom or an exposure, or a healthcare personnel who's just got exposed to a set of positive patients. So that's what will practically work. That's one. If I've answered that, I'll move to the second one. The second one is on paper. The last few days, if you're starting to get antibodies of people who have recovered from COVID and start infusing them into COVID positive patients, they are known to be beneficial. Having said that, I was looking into a very well-written scientific paper yesterday. There are close to about 6 to 10% of individuals who don't have antibodies detected despite they turning negative after being positive. So it's again a tricky situation, but that what we are thinking as infusing antibodies and creating somebody to fight this virus within another individual is definitely a treatment option. So we'll have to start identifying individuals over a period of time who have been positive and have recovered, documented to have recovered from COVID positive status. That's something they'll start to research and try and do it. That will happen in the next few days for sure.
Perfect. Thanks, Doctor.
Thank you.
Next, can we have Mr. Manoj Kumar?
Yes, good evening, Doctor. I'm Manoj Kumar.
Good evening, Mr. Manoj. Yes.
Yes, I'm actually working as an assistant professor in Nehru College of Management. Basically, I have a question. Is that there is a saying, obviously, saying that if we follow something for 21 days, it persists inside us and it will be continuing for future. So now my question is that this particular scene which you are seeing due to coronavirus is for about 40 days. Will this bring a change in the attitude, hygienic and lifestyle of people in future? What do you think?
Yeah, I'm very optimistic about it. It's not going to bring a sea change, but I think people will start to look at it in a slightly different way. There are people who are saying there's going to be a sea change. A lot of things are going to change.
Yes.
We are going to be a bit more hygienic than the past, and we'll try and maintain good, because social distancing or physical distancing is not just about viruses, is it? It's about being very hygienic, giving that kind of a space to another individual when you're in a public platform. So it will bring about change, and people like you and me who have a bit of education should definitely give it a head start and take this. And I'm sure things will change. And
Thank you.
over a period of time, we'll push this back from what we are as a non-communicable disease nation as from today, and we'll just push the infectious disease part back again.
Thank you, Doctor.
Thank you.
Yes, sir. Next, can we have Mr. Setu?
Yeah. Good evening, Doctor.
Good evening, Mr. Singh.
Thanks for sharing your knowledge and insights. It's been really helpful. I just have a specific question. For coronary artery disease patient, like who's had an angioplasty recently.
Yes.
The doctors advise that you need to have a regular walk every day and things like that for at least 1 hour or so. Now, because of this stay at home and lockdown, which is now being implemented, I've not been able to go for my walks. So I just want to know, is there an alternative to it? Should I be worried about it, or is there an alternative way I could, get some cardiovascular or cardio get going?
It's probably the difficult question I've had this evening. So exercise is a very important aspect post angioplasty or a bypass, even without. It really depends on how much space you have within the house. If you have stairs, you could go up and down. It doesn't have to actually happen in a ground or on the road. The exercise, what you can do is what you can create within the place where you live. If you have a treadmill, you could do a walk on the treadmill. If you don't, then you can actually use your stairs to go up. If you have got a terrace, you could use that space. Otherwise, even there are multiple forms of exercise. You could do a bit of gardening if you have one. Suppose if you're in an apartment, you could offer to do the gardening bit yourself. You could wash your vehicles. Any of these and all of these will add up to exercise. It's all about burning calories and keeping yourself physically active. It essentially doesn't have to be walking in a ground.
Okay. No, actually, I don't have a treadmill or anything at home. And so is there anything you could do within your apartment? I mean, would walking within your apartment amount to much? Would it count, or, that isn't really sufficient?
Meaning you could take multiple rounds on your apartment, meaning provided you've taken adequate measures, that there are no people walking close to you, and you could take a few rounds around your apartment. So that should be good enough. That should be good enough.
Okay. And my second question is, in case since I've had an angioplasty about a year and a half back, sure. What is the rough time what one could expect that it would be effective and you wouldn't get into further trouble, say have another blockage elsewhere or something? Is there a normal thumb rule or something to say that okay, for next 10 years there should be a problem with it?
No, either way, it's not possible to say. There's nothing like one should develop a block in the next few months or a couple of years after angioplasty. No, it's not a fact. Also, what is not a fact is the next 10 years, nothing should happen. So this is something like fixing a puncture in the tire. You've seen a puncture and you've fixed it. So you just don't know when there can be another puncture. There might not be one at all. What best you could do is maintain a very good healthy lifestyle, and most people don't get into trouble for quite a few years.
Okay, right. Thank you so much.
Thank you.
Thank you, sir.
Hi.
Yes.
Yeah, this is Vijay here. I don't have a question, but I just have an input. Maybe just to answer the previous person's question about having some exercises in the apartment, right? Maybe I can give a suggestion. The doctor can correct me if I'm wrong. So basically, yes, within the apartment it's always tough to walk around much. But what we can do is, we have the yoga there, but yoga obviously it needs to proper training. But still, there is something called as a pre-yoga where you just stretch your legs, extend your arms. Like some basic exercises are there, which is normally available online. So if you actually try that, it does pump up the cardio a little bit, but not much. But still, it is much better than not having anything. Basically, stretching your arms, legs, all that. Just this is not the asanas as such, but something which you do before the asanas. Just loosen up your joints, stretching yourself, all that. That will actually do a little better than not doing anything. I just suggestion there.
Sure.
It might not actually apply directly to cardio, but at least it will pump up the heartbeat a little bit.
Okay. Thanks so much for the suggestion. Yeah, I'll try that.
Thank you.
Yes, sir. Next, can we have Jayalakshmi, madam?
Yeah. Good evening, Dr. Nanda Kumar.
Good evening,
I've been following up on the news regarding how the Chinese handled this pandemic there. And they say the success of the Chinese is because of an integrated approach. They used their traditional Chinese medicine along with the modern medicine, and that's why they were very successful. So why is that not happening in India?
Well, I really don't know what sort of medicines they really used, because most of it was supportive therapy or treatment. Most people who were affected were given supportive treatment. In terms of traditional medicine, I really don't know what sort of what sort of benefits they have to offer. But then I think India as a country is quite strong with traditional medications and with rich history of Ayurveda, etc. But then only time will tell, unless administered and proven to be working. It's going to be extremely difficult for any healthcare facility to introduce something as a treatment, because this is a problem that's not totally understood yet. Unless presuming that what Chinese did is the right thing, they'll probably have to come out with a very strong paper scientifically to say that this particular medicine was given and this contains such a drug or a composition. And then
yeah, I can forward the article to Kanakraj. Maybe he will send it over to you. Sure. But I don't remember the exact medical names of the medicines, but they did find out that some of the medicines that were prescribed, like this anti-malarial drug that Trump is making a big thing out of, the Chinese found that it was harmful for the lungs or something like that. So that's where they went in with giving them the traditional. It seems they were much better prepared than we were, from what the article says, but I will forward it to.
Yeah, sure. No, I will look in for that. Thank you. Can we have Pratap, sir?
Doctor, just a clarification. Did I hear you say that diabetes might not show early symptoms?
No, I didn't say that.
Okay.
Being asymptomatic has nothing to do with a comorbidity. So
Yeah.
any specific comorbidity. No.
Oh, okay. All right. Thank you, doctor.
I think the questions are over. And do anyone want to have some questions or suggestions or any queries? Yeah. I think, can you take it as no? And Pratap sir or Mani sir, can you sum it up?
Mani, please go ahead.
Mani sir?
Yeah, I'm here.
Can we sum up? Yeah.
Yeah, I think from the basics of cardiology to what's happening in the current scenario of COVID, I think some of our questions were the kind of questions that we posed were childish or immaturish, but I think it was more of what we wanted to clarify heart to heart. It's not that we found a doctor, so we pounced on the doctor. I think we were I think at the end of the conversation, most of our paranoia with respect to the cardiological aspect of us or even COVID, I think we go back stronger. So if not yesterday, I think all of us will go back home and sleep better today, because tomorrow is going to be a better day. That's how I would like to sum up what happened in today's session. It's actually an honor, doctor, that you took your time off amidst this whole situation, listened to us patiently and gave in, I wouldn't say your inputs, it actually was a fantastic clarity to every single question that was posed to you. Thanks a lot, doctor. Thank you.
Thank you very much.
I should
my pleasure.
Thank Gilbert for having taken you into confidence to spare your time along with us. Thanks, Gilbert. Thank you.
Thanks, Mani. Welcome.